want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. It's Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Then, of course, Donald Trump, as we talked about yesterday, announces he is taking this particular unproven drug. Here's the craziness of that video.
And a lot of good things have come out about the hydroxy. A lot of good things have come out. And you'd be surprised at how many people are taking it, especially the frontline workers, before you catch it. The frontline workers, many are taking it. I happen to be taking it. Hydroxychloroquine? I'm taking it, hydroxychloroquine.
When?
Right now, yeah. A couple of weeks ago, started taking it. Because I think it's good. I've heard a lot of good stories. And if it's not good, I'll tell you right, I'm not going to get hurt by it. It's been around for 40 years for malaria, for lupus, for other things. I take it. Frontline workers take it. A lot of doctors take it. A lot of doctors take it. I take it. Now, I hope to not be able to take it soon because, I hope they come up with some answer. But I think people should be allowed to. I think for whatever it's worth, I take it. I would have told you that 3-4 days ago, but we never had a chance because you never asked me the question.
Did the White House doctor recommend that you take that? Is that why you're taking it?
Yeah, White House doctor. I didn't recommend. No, I asked him, what do you think? He said, well, if you'd like it. I said, yeah, I'd like it. I'd like to take it. A lot of people are taking it. A lot of frontline workers are taking hydroxychloroquine. I don't take it because, hey, people said, oh, maybe he owns the company. No, I don't own the company. You know what? I want the people of this nation to feel good. I don't want them being sick. And there's a very good chance that this has an impact, especially early on. But you look at frontline workers, you look at doctors and nurses, a lot of them are taking it.
Yeah, okay, gotcha. All right. Joining me right now is Dr. Sidney Coupe, internal medicine physician and founder and CEO of the Coupe Quality Clinic in Fort Lauderdale, Florida. Doc, I'm going to read this letter here. White House released this letter, memo for Kayleigh McEnany from Sean P. Conley, physician to the president, commander, U.S. Navy. As has been previously reported, 2 weeks ago, one of the president's support staff tested positive for COVID-19. The president is in very good health and has remained symptom-free. He receives regular COVID-19 testing, all negative to date. After numerous discussions he and I had regarding the evidence for and against the use of hydroxychloroquine, we concluded the potential benefit from treatment outweighed the relative risk. In consultation with our interagency partners and subject matter experts around the country, I continue to monitor the myriad studies investigating potential COVID-19 therapies, and I anticipate employing the same shared medical decision-making based on the evidence at hand in the future. Now, first of all, Doc, let's break it down. Nowhere in here does this doctor say he prescribed hydrochloroquine. Nowhere in here. He dances around the subject by saying, we concluded the potential benefit from treatment outweighed the relative risk. 2, nowhere are they saying, why would you take a drug if you don't have coronavirus? When the FDA has already issued a warning stating the only place people should be taking this drug are in hospitals. Are you buying this nonsense?
Roland, by the way, thank you again for having me. And it's always a pleasure to come in and communicate with your audience, yourself, and to provide some education. And, these are real issues, and that's impacting real people in our community. So let's get this cleared up. Number one, hydroxychloroquine or chloroquine is not indicated at this time for any treatment around coronavirus or COVID-19. That's the first thing that needs to be very clear. And I will repeat this. Hydroxychloroquine is not indicated to treat anything around the coronavirus or the COVID-19. Now, we do use hydroxychloroquine for many other diseases, like malaria prophylaxis, right, or to treat malaria, as you all know, very familiar. In addition, there's a lot of rheumatic type of diseases that we treat, we use hydrochloroquine for. For instance, rheumatoid arthritis, we use it for lupus, conditions that might even, involve the skin. So there's some rheumatic conditions that involve the skin where hydroxychloroquine is effective for. So those are the conditions. So as I was listening to the audio, it strikes me. I wonder, does Donald Trump have other conditions that he's taking the hydroxychloroquine for, right? Because, I can tell you now that there's not a physician that would recommend the use of hydroxychloroquine to treat COVID-19.
Especially if you don't have it. Like who takes a drug just for the hell of it?
Right. So I'll say this. So right now, because we have the pressure and the demand of this pandemic where people are dying, clearly, right? So we have a lot of people dying, and there's a race for us and an urgency for us to find treatment and also eventually a vaccination. And so you have that urgency. But also, us in the scientific community, we also know the importance of having evidence-based medicine and evidence-based practice. So, what we're experiencing here in our society is this concept of we are now in a race of getting the right treatment or identifying what works and avoiding to harm people, number one, and number two, to see what's effective. So when you think about drugs like hydroxychloroquine, we're using it in a hospital setting for experimental purposes to see if it's working. Now, all of the observational studies around hydroxychloroquine is not promising, Roland. So although in the beginning of this pandemic, we were using hydroxychloroquine, we were using azithromycin. In fact, I just came back from the hospital. I admitted a patient with, a virus, the COVID-19. And so we are treating it with all types of the experimental medications that were recommended. So hydroxychloroquine is not the only one. So there's azithromycin, and those who are even severely ill, where they are intubated, we try remdesivir, which is an antiviral medication for compassionate use. So I'm sharing all of this to say that, we're in the medical community. We don't have the answers. We're still studying it. And as you heard, about 5 days ago, FDA just approved the first clinical trial for hydroxychloroquine to see whether it has any benefit at all. So far, all of the observational studies have shown that there is no benefit. And we have to think about what are the benefits. So for instance, number one, we got to make sure, does it keep people from getting sick? There's no evidence that shows that. Number two, does it get people better when you use it? There's no evidence pointing to that. In fact, there's evidence showing otherwise.
So for the people out there, especially to our audience, do not listen to anything Trump has to say about this drug. Don't ask your doctor for it. Don't play games with this.
Yeah. And the other important thing is that when you think about conditions like lupus and rheumatoid arthritis, those conditions run rampant in our community. And I have to tell you, I have a lot of patients with those conditions that I use hydroxychloroquine for. And, and these folks are appropriately being treated with that. But this medication is not without its risk. Obviously, every medication has a side effect. Some minor ones that hydroxychloroquine can cause is probably stomach discomfort, nausea, but even vision loss it can cause. But the more severe ones is cardiac arrest. That means the medication interferes with the electrical activity of your heart and cause you to have a cardiac arrest, Roland. So you certainly don't want to take that medication without a prescription or being advised by a doctor. So that's something very important that we have to keep in mind.
All right, Dr. Sidney Coupe, we surely appreciate it, sir. Thank you so very much.
You're welcome. My pleasure, Roland.
All right, go back to our panel here. Malik, do you actually believe Trump taking this drug? Really?
I mean, I'm not. I don't know. People typically don't lie about drugs that they take.
Well,
so
actually, typically presidents don't lie, but this man lies a whole lot.
Yeah, but that's neither here nor there.
No, actually, it's not neither here nor there. He lies a whole lot. I mean, he lies about lies.
Okay, and that's great, but I'm not going to question when someone says that they are taking a drug or they're not taking a drug. I'm not going to second guess whether or not they're taking the drug. He says that he's taking the drug, so if he's taking the drug, I mean, he's taking the drug. But the important thing about this, and I do agree that no one should listen to Donald Trump. No one should listen to me. No one should listen to you, nor Mustafa, nor the doctor that you had on. They should listen to their own doctor. When you're taking any medication, it doesn't matter what it is. Don't listen to what the people on television says. Talk to your doctor. Any decision that you make about your health should be in consultation with your doctor, not any of us. We can all have opinions on it, but at the end of the day, these are decisions that need to be made between you and your doctor. And if Donald Trump's doctor said that it makes sense for him to take hydroxychloroquine, then okay. But I mean, that's his decision.
I'll say this, Kelly. Listen to us before you listen to Donald Trump on anything, because this is a dude who lies about everything.
I mean, that's here and there, right? But this kind of hits home for me, specifically the hydroxychloroquine medicine, because I have, like the doctor said, I have a lot of family members who deal with the ailments that hydroxychloroquine treats. I have very close family members who have lupus, rheumatoid arthritis, skin conditions. It's not uncommon in the Black community for us to have these ailments, and for him to isolate this drug specifically to further the cause of, oh, this is a cure for COVID. I mean, the conspiracy theorist in me, that's very small, but still there, can't help but wonder if there's a reason for that. Because he could have chosen any drug. He could have chosen any drug to exploit. And it had to be the one that a lot of African Americans and people of color use for ailments that are common within our respective communities. He very well might actually take it for other purposes. It's not like there's a monolith on rheumatoid arthritis, lupus, and the like. I'm just saying who it affects the most, and it doesn't happen to be rich white men. That's all I'm saying.
Mustafa, to hear Trump just throw this sort of nonsense out there, I mean, game recognized game. You want to switch the subject. 91,000 Americans have died from this whole deal, and no one with any common sense, no doctor's just going to give the president of the person who's occupying the White House, experimental drug just for the hell of it. Yeah, okay, sure, dude. So you're telling us you're taking this drug, but you won't release your taxes. All right, we got you.
Right. Especially this drug. We know that the president, he's reckless with the tongue. We can say it that way. He also, unfortunately, just creates these scenarios and these situations, as everybody else has been sharing, that is impactful to real people in their real lives. My sister has lupus. When people started rushing out and getting this drug, she had difficulty in actually being able to get it. So the president just needs to be more serious and more careful, changing the narrative. Everybody knows that he's played a huge role and has a lot of responsibility in the numbers of lives that are being lost. And we can unpack that. Anybody who ever wants to debate that fact, we can take it clear back to the beginning. So for him to continue down this road, if he really wanted to change the narrative, do some things that are actually promoting good. Work with the Republicans on the Senate side to make sure the stimulus bills actually have what's needed in there to actually give the states and local governments what they need to be able to properly fight the epidemic that we find ourselves in.
All right, folks, back to our Roland Martin Unfiltered video in just one moment.
This is the Seek VR headset created by Mary Spiel, the sister. We had her on the show. Black woman. She actually is the inventor of this particular headset. And so what happens is you just simply place your phone right into here, and then of course close it up, and then go to their website and then their app, and you can actually experience the comedy showcase. And so they have these headsets, these VR headsets on their site, seek.com, for sale. Then also they have these 4D 360-degree headphones. First of all, I love the two stuff because they're in black and gold, my frat colors. But these are awesome because for gamers, it comes with detachable headset, and again, folks, it gives you 360-degree sound. Amazing sound. If you want to buy these, you have a promo code you can use. This is just for our followers, and it is RMVIP2020. RMVIP2020. Put that promo code in if you want to buy the headphones, buy the VR headset. You get that discount to buy it. They're amazing. So seek.com, RMVIP2020.
Now back to your Roland Martin Unfiltered video. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible.
Senator Rand Paul. Joining us right now is infectious disease specialist Dr. Alexia Gaffney. Glad to have you back on Roland Martin Unfiltered.
Great to be.
You have these people who are just insistent. Send the kids back. And again, as Dr. Fauci said, we don't know enough. I mean, what I don't understand is how difficult is it for these people to understand that we literally have not tested enough Americans to have a real understanding of what's going on with this disease. And these folks, they have no problem risking thousands upon thousands dying just to rush out and reopen.
Yeah, it's, but I don't know why we're surprised, right? We live in a society that has valued money over lives for the longest time. And, you know, we are looking at it, you and I as Black people, that is it because it's us dying that nobody cares and that they're willing to throw us all out there and see what happens, you know? But it's not the time. There are too many people who are walking around with this infection, either not experiencing symptoms, so completely unaware that they have the infection, or people who are experiencing symptoms, but like so many people out there, and as our government is proving, just don't care enough about society as a whole to do what we need to do and just hunker down, stay still, and see what happens over the next couple of weeks or months, whatever it might be.
So what is still amazing is that part of the testimony is that they say that, by September, we'll be able to test 40 to 50 million Americans every single month. Okay, here's the problem with that. They told us in March we're going to be doing 4 million a week. Okay, You do the math, that's 16 million a month. We're not even doing 16 million a month right now.
No, we're not anywhere near that. And the rollout of testing has been ineffective. There's not been enough tests immediately when we were at the peak of the situation. And then everybody does not have access to testing. And then now on top of it, I think people are going to be fearful of getting tested because they're concerned about contact tracing and what is going to be the result or outcome of that. Is that going to lead to policing of certain people or certain enforcements? And we already know how that goes in our society. Some of us are simply policed differently, and some of us, the rules don't apply to some people. So there's going to be fear and concern about testing from us, from Black people, from brown people, from minorities, from people who are fearful that they will be discriminated against once it is known that they carry this virus. So there's just too many missteps, there's too much lack of information, and there's not enough planning and consistency. And so many promises have been broken. How can we have faith in this system if it's not delivered on the promises it's already made? And now the system is throwing us to the wolves.
So listening from what you heard today with this testimony, what really is our road forward? Or what should it be?
So our road forward should be to just continue to have the country on pause. We are not ready to reopen. The numbers are not low enough, and we have not yet flattened the curve for all of us to simply reopen our states and go back to business as usual. Even when the numbers are low and it is time to reopen, the reopening really needs to be very strategic. We can't all come out at once. It really needs to be what is the most necessary essential services above and beyond those that are already open and available to us. And it needs to be a staggered rollout. You can't fill an office building or a business with people and have people sitting next to one another in desks or cubicles, or folks riding in elevators together. There's so many levels and layers to what needs to happen when the country reopens. And even if we do everything under the most ideal circumstances, if we follow the CDC guidelines and recommendations to a T, we are still going to see a spike in cases because the virus has not left. But we would see less
cases and less fallout and less overwhelm of our healthcare system if we do it strategically. So we really just need to slow down, and we really need to recognize that dollars in the economy is never more important than human lives. And that's what's not being understood, in my opinion.
All right, then, Dr. Alexia Gaffney, we certainly appreciate it. Thanks a lot.
Thanks for having me on.
Every single night, we've got some of the top Black experts. You're not going to see them on cable news or broadcast news because you swear Black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first Black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patel Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward, Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris, Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie British Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is a mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon McDougall, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the Black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. This is real what we're dealing with. Dr. Tayson Bell, critical care and infectious disease specialist, University of Virginia. Dr. Bell, welcome back to Roland Martin Unfiltered. You heard the conversation we were having here. Yeah. Doc, when Donald Trump stands before cameras and what comes out of his mouth, testing is overrated, that has to anger you as an infectious disease specialist.
It is absolutely infuriating to see the leader of our country spewing this nonsense. Testing is absolutely important, and everyone who has any sort of confidence or intelligence about them understands that in order to safely open up the country, to know what's going on in our communities, you absolutely have to have testing. And the reason It seems like we haven't met the goal, and so he's shifting and saying it's not important. It's always been important. It always will be important. The fact that you're not making it there, you need to own it up and just say that this is what we need to do to increase our testing capacity. You don't then say it's not important. So yes, when I saw that, so first of all, I've learned to just expect nonsense, but every now and then it just seeps to a lower level. This was beyond the pan, beyond the fold, and I couldn't believe it. I have no words for it.
And again, when we see the fact that we just showed the graphic there, nearly 90,000 deaths in this country. We'll be at 100,000 next week. And again, the moving of the goalposts, it also has to be infuriating that we don't have a national testing strategy. That I remember the news conference, the Rose Garden. It was CVS, and it was Walgreens, and it was Walmart. How we're going to have remote testing all around the country in these parking lots. Hasn't happened. He stood there and touted, Abbott has this great test, unbelievable test. Now the FDA is warning about all its negative results because, again, wasted time. 1 or 2 months is critical in a pandemic. That is an eternity to be behind in a pandemic when the CDC and this administration farted around for 2 months and Trump is out there going, oh, there's only one person here from China who has it, or we have 15 cases, it'll soon be down to 0. Or you have Larry Kudlow who said, oh, no, this is close to being airtight, contained, don't worry about it.
Yeah, like I said, 90,000 people have died. The case count is actually much higher than that, most likely, because we've seen that a lot of people have died from illnesses related to respiratory causes that have not been diagnosed because they were not tested. So the death toll is much higher than that in actuality. And, we talk about statistics a lot, but when we round in a hospital, we see these patients. These are 90,000 lives of men and women, a lot of them black and brown, who have families, who have jobs, who have livelihoods. And these are people who are not coming back. They can't speak for themselves anymore. Time is life in this pandemic, and information is life. We absolutely have to get responsible, accurate information out there. We have to trust the science. We have to follow this. And to politicize any aspect of this is absolute nonsense and it's dangerous.
A vaccine might be a vaccine by the end of the year. But we've had numerous experts who said, folks, look, it's going to be 12 to 18 months. You had Dr. Bright yesterday testify before Congress. He said it's going to be 12 to 18 months at its earliest. Your assessment of where we are.
Roland, I certainly hope that we have something by the fall. But vaccines take time. You have to go through a rigorous clinical trial process. You have to make sure that they work. You have to make sure that they don't cause more illness. So SARS and dengue fever are examples where the vaccine actually caused more harm and people got sick from it. And so that process takes time. There is this group out of Oxford who has somewhat of a head start on the process, and they think that they can accelerate the normal timeline. We'll just have to see. So I don't think it'll be ready, but I hope that I'm wrong about that.
There was a news conference today where there was this big announcement about coronavirus drugs and things along those lines. Again, and what's crazy is to watch it and to listen to Trump downplay the very thing, and which is still illogical. So I want to play this for you.
I know you will. Any questions, please? Yeah. Go ahead.
Mr. President, you said no vaccine or no vaccine or bad. What did you mean by that?
We think we're going to have a vaccine in the pretty near future, and if we do, we're going to really be a big step ahead. And if we don't, we're going to be like so many other cases where you had a problem come in, it'll go away at some point, it'll go away. It may flare up and it may not flare up. We'll have to see what happens. But if it does flare up, we're going to put out the fire, and we'll put it out quickly and efficiently. We've learned a lot. Steve, do you have a question?
We've heard that the vaccine typically would take 12 to 18 months to develop. How can you do it in a speedier fashion? What makes you think this will work?
Well, they started actually, I guess you heard, in January, early January, and they've been working on it. I know so many, and private companies have been working on it. The government's been working on it. So we've got the time because we put and they've literally been working 24 hours a day. So we've got the time, and we hope to be able to do something by the end of the year or shortly thereafter. But again, it's not solely vaccine based. Other things have never had a vaccine and they go away. So I don't want people to think that this is all dependent on vaccine, but a vaccine would be a tremendous thing. And I will tell you, therapeutically or therapeutics, what's going on there is equally as impressive. We have some things happening. We have the remdesivir from Gilead. We have other things that are very good. I think that a lot is happening therapeutically. I can't say that it's, relatively speaking, equal to what's going on with vaccines, but I think it's doing very well, very well. So therapeutics are a big factor. Yeah, please.
Is there a global competition?
Dr. Bell, can you even attempt to, please, by all means, just go right ahead. I don't know what the hell I just heard.
Can we just shut him up? I mean, let's just get him off the stage. At some point, someone who's working around him needs to say this nonsense that's coming out of his mouth is making the country less safe. People are going to die if you give inaccurate information. It's remdesivir, first of all. That's the name of the drug. It has efficacy. We've talked about that on the show before. We have that. We don't have a vaccine yet. So to tout a process where we don't have anything yet and say that it's more promising than something that you've already developed and you see that it has an effect, that's utter nonsense. And this talk about it's going to go away, it's going to go away. That
Right, like it'll be, it's like pollen. Oh, it's gonna blow away. It'll be gone.
We've seen time and time again that infections like this can come back. They can persist in the summer. 1918, the Spanish flu came back with the rage the second season in the fall.
It actually killed more people in the second wave than the first one.
Exactly. You just need to pay attention to history, pay attention to your scientists. And if you don't know, that's okay. You don't know. He's not a physician. No one expects him to be a physician and to understand the subject matter. That's okay. That's not your job as a leader. Your job as a leader is to get people around you who know what they're talking about. And when something comes up that they're a subject matter expert in, you get out of the way and let them talk. And the fact that Dr. Fauci, Dr. Birx, the people who know what they're talking about, Secretary Azar, they are not on the stage anymore. That is really concerning to me. And the fact that it's replaced by this person who is spewing utter nonsense, it makes me mad because, Roland, honestly, physicians on the front line, nurses on the front line, we will see the effect of inaccurate information, of inadequate testing, of inadequate care, of racial disparities. We will see all of that manifest in the unit, in the hospital. We will see these people suffer. We will see these people die. And when the power of accurate information can help turn a tide of this pandemic, and you just see what's happening on the stage right there, I'm so angry right now.
I do have to ask you this before we go, and that is, I saw this story about Dr. Joseph Fair, the NBC News virologist, who said he did everything right. He said that he followed every precaution, flew on a packed plane somewhere. He believes he got it through his eyes. So now I'm like, okay, so do we? I mean, everyone's saying masks, but do we now have to wear goggles? Do we not? I mean, what do you make of this?
Right. So we've known for a while that if you're in close contact, it can be contracted through all of your mucous membranes. These are your surfaces that make liquids. So your nose, your eyes, your mouth are included in that. If you're in close contact, then it can get into your eyes and cause infection that way. And that's why part of PPE, when we go into patients' rooms, includes a mask and goggles or some form of eye protection so that we can make sure that we protect ourselves that way. I think for the general public, if you're maintaining that social distance of 6 feet or more from people, the chance that those secretions or things that come out of people's mouth or their nose when they cough or sneeze, not as far to get directly in your mouth. But if you are going to be in close contact with other people for a prolonged period of time, I'm thinking dentists, barbers, that's a good idea to put some eye protection on.
Dr. Taysom Bell, we certainly appreciate it, man. Thank you so very much for your insight.
Thank you.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardy, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patal Saul, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, infectious disease specialist, Dr. Georges Benjamin, executive director of the American Public Health Association, Malcolm Nance, family medicine physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Springs, AFL-CIO economist, Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the Root. The Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi, Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible. Lieutenant Governor of Michigan, Garland Gilchrist. They have been dealing with a major issue there. Many people in Detroit have passed away from this. We have seen just this dramatic impact as well. He has created a task force to tackle the racial disparities as a result of social inequalities in places like Detroit and Flint. Lieutenant Governor Gilchrist, how are you?
Roland, it's good to be here with you, my friend.
First and foremost, let's talk about this. You just heard Dr. Taysom Bell. You hear this nonsense coming from Donald Trump that this thing might just go away. Well, vaccine, maybe we don't need a vaccine. We got therapeutics or whatever. Yet we're seeing people who are, a bus driver in Detroit, woman coughs, he's dead 2 weeks later. This is not, and all the people trying to talk about, HIV and AIDS, look, you can get HIV or AIDS and you can live for the next 20 years. We're seeing people who are dying 2 weeks later.
This is real. And to put this on a personal perspective, I've lost 20 people in my life to COVID-19, including a cousin yesterday. This is hitting our community, the Black community in particular. in ways that it's not hitting other parts of our population. I mean, in Michigan, Black folks make up 14% of the population, yet we've accounted for 40% of the people who've died, 41% actually, of the people who've died in the state of Michigan. So that disparity is clear, and this virus kills so quickly. And to your point, we have so many people of color, and Black folks are overrepresented in the people who, even in the midst of the stay-home orders that have been in place in Michigan and other parts of the country, have still had to go to work because you work at a grocery store, you're a bus driver, you're a nurse, you're an administrative professional at a healthcare facility, you're a utility worker, you're a first responder. And so you're out there risking your life to make sure others can stay home and stay safe. And that is one of the things that the Task Force on Racial Disparities here in the state of Michigan is looking to tackle. What kind of protections can we have for uniquely vulnerable people? And in places all around this country, that's Black people.
Are you in Michigan, are you getting what you need, or are you still battling with other states for PPE, for other things along those lines? Because you swear, listen to Kayleigh McEnany and Trump, that all states are getting everything that they need. We're all fine. We're great with tests. Everybody is good.
I mean, the lack of a national strategy on testing and on personal protective equipment absolutely directly contributed to loss of life in my city of Detroit, where I'm speaking with you from right now, in the state of Michigan and across the country. We have worked hard, and frankly, I think every state leaders across the country have worked as hard as they can to try to procure equipment, to procure testing kits and testing component in the absence of that national strategy. And we've put in place plans where now FEMA is stepping up. And now they are delivering equipment and testing swabs and components so that we can ramp up our testing, because there is no way to move forward without adequate testing. But we still need more from the federal government. This is the job of the federal government, to make sure that every state in our nation has the resources they need to respond to things that are bigger than statewide problems. And certainly a global pandemic qualifies for that. So we're on the right path, thanks to the professionals who've been working so hard in Michigan, in the public and the private sector, at the municipal level and the state level. People have really stepped up and stood tall. So I'm proud of that work, but we have a lot more work to do, and we can do it better when we come together.
When we talk about how so many of us are being impacted, New York Times has a story now about all of these hospitals who have stopped surgeries, losing lots of money. Mayo Clinic could lose $900 million this year. Johns Hopkins, $300 million. But many of the hospitals that serve low-income folks are even in a more desperate situation. What is it looking like there in Michigan?
I mean, it's been a tough situation, and it's been, frankly, tragically ironic to see hospital systems doing cutbacks in the face of the biggest public health challenge of any of our lifetimes. But it calls into question and a bigger understanding as to how hospital business models work. Certainly the reason that we asked for there to be a pause in those sort of elective procedures is because we needed to make sure that all the equipment was available to treat the spike or the potential spike in COVID-19 patients, that we had as much medical equipment, hospital, bed, ICU capacity so that we could take care of people who may have contracted this deadly virus. And so as we move forward, as our public health system has built that surge capacity and now may have the ability to withstand any surges in the future, we're on a path towards re-engaging those type of activities and those kind of surgeries. And I think that's going to help that hospital business model.
Before you go, I got to ask you about this here. The decision not for the legislature not to meet because of these armed protesters. I'll be perfectly honest with you. I can't imagine state legislators, if a group of Black protesters were there, they're saying, oh, no, we're too scared to meet. That's why you have police. That's why you have folks there. I mean, that to me, basically, these thugs got exactly what they wanted by intimidating state officials in Michigan.
Well, let me be clear about something. First of all, I'm the president of the Michigan State Senate, the first Black person to serve as lieutenant governor in our state. And so I was presiding over the chamber when you had men with guns as tall as I am, and I'm 6 feet 8 inches tall. Mm-hmm. They're parading and intimidating and brandishing them and scaring lawmakers. And, we had a lawmaker from Detroit who wore a bulletproof vest because she feared for her safety. And you're absolutely right that if a group of armed Black men came to the Michigan Capitol, where we still are one of only 2 states that allows open carry in our state capitol, yeah, that could have went a whole lot differently. And we were certainly thinking of the history with the Panthers when that happened and they changed the laws in the state of California and across the country. But I want to be clear. They were not there, frankly, about the stay home, stay safe order. They weren't there about COVID-19 because, you can't shoot a virus. So having a gun at that kind of protest or demonstration has another purpose. And especially when you couple that with the racist imagery you saw. I mean, we had a state senator wear a Confederate flag on his face. We had people having those Confederate flags draped on those weapons. We had Nazi swastikas. We had, sexist symbols of people hanging Barbie dolls because we have a female governor here in the state of Michigan, Gretchen Whitmer. That was a political rally empowered by the dangerous and destructive rhetoric of the president, who has politicized the response to this pandemic in a way that is costing people lives. And those people thought they were standing up for him. They were standing up for politics. But our role as state leaders and as public servants is to protect and promote public health and public safety. And so that means that we're going to make decisions for people and not for politics. And going forward, we're going to make sure that we have a more equitable distribution of how law enforcement treats people who are not stepping up and doing what they need to do to protect themselves, their households, or our communities.
So will the legislature in there in Michigan, will they step up and ban guns in the state capitol? Go ahead.
The ball is in the legislature's court. So our legislature in Michigan is controlled, both chambers, by Republicans. And I think one of the reasons why you haven't seen stronger action, and instead you've seen fraternizing with those people who were in our gallery with long guns, is because, frankly, they agree with the protesters. Because, as I said earlier, they have politicized the response to a pandemic. We are planning in the best interest of public health and people, following the world-renowned experts, including the leadership of our medical executive, Dr. Jonae Caldoun, a Black woman. They may not like the fact that we have such a diverse leadership team here in the state of Michigan. But I'm here to tell you that we're working on behalf of the people of Michigan, and we challenge the legislature to step up and do the right thing to make sure that lawmakers can do their job and conduct the people's business. The legislature claims they want the power and the opportunity to do that. It's difficult to do that under the intimidation of open carry brandished firearms.
Lieutenant Governor of Michigan, Garland Gilchrist, we certainly appreciate it. Thanks a lot.
Thank you, Roland. Take care. Stay safe.
Yes, sir. Every single night, we've got some of the top Black experts. You're not going to see them on cable news or broadcast news because you swear Black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered. Joining us right now is retired General Russell Honore, the nation's first Black Surgeon General, Dr. Joycelyn Elders. John Hope Bryant, he is the founder of Operation Hope. Senator Kamala Harris of California, Dr. Sadrina Calder, retired General Lloyd Austin, Congresswoman Karen Bass, Commissioner Omari Hardick, Bureau President in Brooklyn, Eric Adams, Dr. Joseph Graves, America's Wealth Coach, Deborah Owens, Dr. Corey Abear, Patal Salt, Howard University student, Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, Senior Economist at the Center for American Progress, Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is President of the National Medical Association, President of the American Medical Association, Dr. Patrice Harris. Joby Benjamin, Dr. Alexia Gaffney, Infectious Disease Specialist, Dr. Georges Benjamin, Executive Director of the American Public Health Association, Malcolm Nance, Family Medicine Physician, Dr. Jen Caudle, Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University, Congresswoman Yvette Clarke from the state of New York, William Spriggs, AFL-CIO economist, Andrea James, Executive Director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Enid Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan Hayrie, ACLU Justice Division Strategist. Dr. Cindy Duke, she is a virologist. Principal Steve Perry of Capitol Prep. Health and Wellness Specialist Dr. Yolandra Hancock. Desmond Meade, President of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with the Root. Lamina McWhorter, founder of Love by the Hand. Dr. Julianne Malveaux, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark. Justin Gibney, attorney and political strategist, and Bishop Vincent Matthews Jr. Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon Madugal, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King. We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the Black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope.
or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. You can make this possible.
Donald Trump, in his attempt to change the news cycle, which I think that's what he did, he announces that, he's taking this hydrochloroquine, this drug, this drug that he's been touting somehow could be the miracle drug. This is what he said today in his roundtable.
But I get a lot of tremendously positive news on the hydroxy, and I say, hey, you know the expression I've used, John? What do you have to lose? Okay, what do you have to lose? So I have been taking it for about a week and a half.
Every day?
At some point, every day. I take a pill every day. At some point, I'll stop. What I'd like to do is I'd like to have the cure and or the vaccine, and that'll happen, I think, very soon.
And you've had no symptoms, sir?
Zero symptoms. No, I haven't had any symptoms. No, I test every couple of days. They want to test me, for obvious reasons. I mean, I am the president. So they want to test me. I don't want to be tested, but they want to test me. So every couple of days I get tested, and I've shown always negative, right? Negative. Is that the term you use for this, right? Negative. Totally negative. No symptoms, no nothing. But no, I take it because I think I hear very good things. Again, you have to go to frontline workers. Many frontline workers take it, and they seem to be doing very well.
First of all, let me just cut to the chase why what you just heard is bullshit. Okay? No one in their right mind is going to take a drug, a dangerous drug that has significant side effects if you're not showing any symptoms. Now, here's what we know. We know that his valet has tested positive for coronavirus. We know that Katie Miller, Pence's press secretary, has tested positive for coronavirus. She's married to Stephen Miller, his one of his top domestic policy aides. If y'all actually trying to get me to believe that, he's taking it, no. This is Donald Trump trying to move the conversation. Here's a video of Dr. Rob Davidson, who posted this video on Twitter soon after this announcement. Listen.
Hey, it's Dr. Rob here. Just heard that President Trump announced today that he has been taking hydroxychloroquine to prevent COVID-19. And if everything else we know about President Trump hasn't proven to you that he does not understand medicine or healthcare, and certainly doesn't have your best interests at heart, this statement and the fact that he's taking this drug should be everything you need to know. The FDA recently issued a warning that this should not be used outside of hospital settings because of the risk of death. We know that patients with lupus depend on hydroxychloroquine, and when President Trump was touting it in March, that they ran into shortages. Now, if someone on lupus who takes it all the time runs out of this drug, they can suffer from kidney failure and life-threatening blood clots. And so President Trump is not only putting those people at risk by touting this drug again, announcing that he's taking this drug against the advice of doctors, against his own White House doctor advice. This hurts those patients and potentially hurts other people who will start taking the drug to try to prevent it, or when they have mild symptoms that could be from COVID-19. Recently, we know there's evidence popping up that there are increased deaths with hydroxychloroquine. And we know that there is no evidence that this drug works, none. This study, quote, study out of France was completely flawed. Any data that has existed has been debunked. We want it to work. We want something that works, but we know that hydroxychloroquine isn't it, at least not yet. And the president is being reckless in his announcing that he's taking it, and in taking it in the first place. We in the healthcare field need to come out with one voice against the use of this drug, against the advice of this president, knowing that he is going to put more people in harm's way. Be safe out there. Please stay home. Please observe social distancing and wear masks when you're in public. And above all, listen to healthcare experts, not the president.
Eugene, he's lying. Eugene, you cannot convince me that the FDA issued that warning and his doctors would allow him to take this drug. He's lying. What he is doing is trying to get the folks off the focus, the fact that 90,000 people have died, and we may very well hit 100. CDC is saying we're going to hit 100,000 by June 1st. We may hit 100,000 by Friday.
Yes. The thing is this, right? He's either lying about one or two things. He's either lying about taking the drug, or he's lying about either contracting COVID-19 or one of the other reasons that this drug is administered and applied. But the fact does remain that no credible, credited, licensed health professional will just let him willy-nilly take this drug like he's taking a daily multivitamin. This drug is not some kind of preventative panacea against coronavirus. It's a very dangerous drug. It's a drug that has very dangerous side effects. And, for somebody to be the president of the United States, you would want to think, especially of his age and the risk categories that he falls well within, that you want to think that he would want to avoid any kind of risk that could put his life at risk and our country at risk.
Avis, you really think a doctor, a White House doctor, is going to let a 73-year-old man who's sitting in the office of President of the United States take a drug that they have said do not administer unless you're in a hospital? We know he's playing people. He's playing them, and he knows it, because here's what we also know. When he went to the doctor in December, they have not been honest about his health reports. We know that. They have not been honest about his medical records. And so, okay, you want us to believe that? Bring the White House physician, have them stand in front of the media and answer questions for 2 hours with regards to this process. How long is he taking it? How often is he taking it? What's the dosage? All of that. I think Donald Trump is lying again.
Absolutely. That, or where the heck is the war on drugs when we really need it? Because this is supposed to only be available via prescription. And so if he has not gotten a prescription, how did he get the drug, right? He would have only gotten it illegally, which means that he's a drug user and needs to be in jail, number one. Number two, I think that but I do believe that it's a lie, number two. And I think it's a lie because this is his constant pattern of deflecting. However, I think he's deflecting not just from the, apparent numbers that we just saw, over 1.5 million people infected that we know of, given the paltry amount of testing that we have in this country. Over 90,000 people dead that we know of, because we only can count those people who were tested and positively as having died from that disease, right? I think he's also looking to deflect from the fact that we just had his whistleblower testify, his latest whistleblower, he's had so many, his latest whistleblower testified in front of Congress last week and then just last night on 60 Minutes. And one of the things that this whistleblower blew his whistle about was the dangerous nature of this specific drug and the fact that this administration was spending so much money to stockpile it when there was no evidence that it had any sort of relationship to actually being able to cure or help this disease at all. In fact, he was arguing that basically this administration's main priority was to put money into the pockets of their corporate friends. And this was just one example of it. And so what he's doing is he's trying to, once again, make the media say, look at me, and cover my ridiculous clown show over here, while the real news that you need to be covering and blowing the alarm on somehow it gets swept under the rug once again.
Patrice, the phrase "he's lying" is trending on Twitter right now. One of the top tweets trending because he is lying. And not only that, everything Ava said, let's also remember he fired the Inspector General in the State Department on Friday, late Friday night, who was investigating Mike Pompeo's use of aides to wash dishes, walk his dog, get his dry cleaning, which you're not supposed to do. That's what's going on here. No doubt about it.
Yeah, I mean,
I want to just reiterate what Ava said about how this is just a distraction. And a lot of media is falling for it right now. The main business model for media, whether it's television or especially digital media, is to get eyeballs in order to, get ad clicks and whatnot. And so I've heard people say, why are we still covering these particular, areas of misinformation? Why are we giving him a platform? And that is something I entirely agree with. I think, between the fact that we don't have the coronavirus task force press briefings anymore, and that we have so much misinformation, it's oversaturated at this point and has been for a very long time. I think we really need to hold the media accountable in terms of the opportunities and platforms we give this man to disseminate this misinformation.
But here's why you have to cover it, because the problem is this here, okay? When the President of the United States speaks, people are going to cover it. And the reality is there are going to be people. We saw what happened before. When he touted this drug, the people who have lupus, who are impacted by this drug, were freaking out because they were saying, we're running out of supply. What's going to now happen, he throws this out here, this is going to happen again. When he sounded like a fool, that was disinfected, and there were people who were literally calling and ingesting disinfectant because this nutcase said it. And so Donald Trump is actually he is a danger to the public when he speaks. Mm-hmm. And so we have to say, don't listen to the idiot in chief, because he's lying. That's why I played the video of that doctor who was saying, do not listen to the president because he's lying.
Right. And I do think that, just like the doctor said, that medical professionals, they need to also be given the platforms to disseminate their information, because, Trump is getting a lot of it. He gets clicks. Media companies are profitable because he gets a lot of traffic. And I do think, the medical professionals also need to receive this amount of attention.
Well, that's one of the reasons why we've had more than 80 experts on this show for those very issues. All right, folks, back to our Roland Martin Unfiltered video in just one moment. This is the Seek VR headset created by Mary Spiel, the sister. We had her on the show. Black woman. She actually is the inventor of this particular headset. And so what happens is you just simply place your phone right into here, and then of course close it up, and then go to their website and then their app, and you can actually experience the comedy showcase. And so they have these headsets, these VR headsets, on their site Seek.com for sale. Then also they have these 4D 360-degree headphones. First of all, I love the two stuff because they're in black and gold, my frat colors. But these are awesome because for gamers, it comes with detachable headset, and again, folks, it gives you 360-degree sound. Amazing sound. If you want to buy these, you have a promo code you can use. This is just for our followers, and it is RMVIP 2020. RMVIP 2020. Put that promo code in. If you want to buy the headphones, buy the VR headset, you get that discount to buy it. They're amazing. So Seek.com, RMVIP 2020. Now back to your Roland Martin Unfiltered video. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real. As Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. Issues. Now you got Trump doubling down on defending himself against criticism from medical experts that his announced use of a malaria drug against the coronavirus could spark widespread misuse, and it has potentially fatal side effects. Here's the whiner in chief.
The FDA has said hydroxychloroquine should not be used outside of a hospital setting or...
No, that's not what I was told. No, there was a false study done where they gave it to very sick people, extremely sick people, people that were ready to die. It was given by obviously not friends of the administration. And the study came out. The people were ready to die. Everybody was old, had bad problems with hearts, diabetes, and everything else you can imagine. So they gave it. So immediately when it came out, they gave a lot of false information. Just so you understand, great studies came out of Italy on hydroxy. You know what I'm talking about, right? Right? Great studies came out, and the combination of the three. But we had some great studies come out. Italy, France, Spain, ourselves, many doctors. But I think it's worth it as a line of defense, and I'll stay on it for a little while longer. I'm just very curious myself, but it seems to be very safe. But that study was a phony study put out by the VA.
Cable. And here we go. Trump with his usual nonsense. There's all kind of other stuff that's going on when it comes to the issue of the coronavirus. They're spreading crazy information. They're spreading misinformation as well, folks. It makes no sense what is going on. You also have doctors and scientists in the United States and Europe concerned about a mysterious new pediatric illness that appears linked to COVID-19. Instead of attacking the lungs like the adult does, like the disease does in adults, this syndrome, while seemingly very rare, can trigger serious and even deadly cardiac complications in children. Plus, we have false negatives involving coronavirus as well. The Abbott test they've been touting, FDA is warning about that as well. Lots of things to talk about. Let's bring up, of course, sister, you know her so well. We've had her on the show many times. She's been giving great information on this, and there's Dr. Ebony Jade Hilton. She's associate professor, anesthesiology and critical care medicine, University of Virginia, and medical director at Good Stop. Dr. Hilton, glad to have you back on the show.
Thank you for having me back. I wish there was nothing to talk about, but here we are.
All right, so we've got craziness from the whiner-in-chief touting this drug, and what's interesting is his own doctor put this statement out, but nowhere in there did the doctor actually say he prescribed the drug. And, they're dancing around this, and so what did you just make of the silliness coming from Donald Trump about this drug?
I don't believe him at all, for one. It is one of those things that I think he says things on the spur, and it's unfortunate that we cannot believe and trust the words of our president that's in charge of keeping us all safe and keeping our nation intact. But I think he truly made that up on the spot, which is why he couldn't say the word hydroxychloroquine and tried to play it off, which is why he also couldn't say the word doctors. Also tried to play that off. I think we have a problem. But that being said, to either lie about taking it or to pressure a doctor into prescribing it for you when there's known risk and side effects of this drug, when there's no clear indication for you to take that drug, that is insanity in either direction.
And again, you have this constant defense of it, even though the test results have shown it is not doing anything for these people who are suffering from coronavirus. It's like this idiot can't get it through his head that he's wrong.
Right. And the study actually came out of the University of Virginia, where I work, looking at VA patients. And what we saw is that it actually had worse outcomes, that those patients who were on hydroxychloroquine alone had higher mortality rates. That means they died. And the thing is, he brought up the fact that these patients were already really sick, that they were really old, they had many comorbidities. But that's the type of patients that we actually have to put you on medicines when you have COVID-19, because you are dying and we're trying to figure out a medicine that could help you not to die. So the fact that this medicine caused more people to die while on it is a bad indication for its utility in medicine. And so even in his own words, he basically explained why we are not using hydroxychloroquine at the University of Virginia.
So again, the FDA has warned that the only people who should be prescribing this drug is if people are in hospitals. So people who are at home should not be taking this drug just for the hell of it.
No, I mean, this drug is excellent for what it's useful for. Those with lupus, those with other types of conditions that have been prescribed this medication and monitored, their lab work monitored, their EKGs monitored, fantastic. If you have malaria, fantastic. But if you're just taking this as a preventative, as he's suggesting that he is doing, that's not what you do. If anything in medicine, as medical providers, we try to get you off of medicines as quickly as possible because we know that every medicine has a potential for a side effect. Yes. And this medicine in particular has a decent amount of cardiac arrhythmias that are associated with it. And so we try to limit its use as much as possible, but there are certain conditions where people need this medicine, and we need to use that medicine for those individuals and not for someone who's making up things at the spur of the moment on a press conference.
So, for all the folks who are sitting here watching, who are paying attention, I keep saying this. If there's any advice that's coming out of the mouth of Donald Trump, completely ignore it. Even Neil Cavuto on Fox Business was saying the exact same thing.
Ignore it and or do the direct opposite is what I found to be most accurate because, for instance, he's not wearing a mask, of which, yes, we know that the mask does not 100% prevent any transmission, but he is around how many people now that are testing positive for COVID-19? And for him to continue to be reckless in his practice is absolutely, I think, the pure definition of insanity. At a certain point, you have to realize that we are all mortal. And that he's putting himself and therefore our nation at risk.
All right, I want to bring in my panel here. A. Scott Bolden, former chair, National Bar Association Political Action Committee, Lauren Victoria Burke, NNPA, Dr. Jason Nichols, Department of African American Studies, University of Maryland. Jason, I'm going to start with you, and folks keep Ebony there, Dr. Hilton there. Jason, what I see what's going on here is, and again, I see complete dereliction of duty coming from this White House. You have Trump in these news conferences making people take off their masks to ask questions. You have cabinet meetings where they're not sitting spacing away from one another. You've got Mike Pence who says he's not on this drug, but he's been self-quarantining because one of his staffers actually tested positive coronavirus. I would dare say everything that should be done to take precautions against this, follow nothing this administration is doing because they're not practicing what the doctors are actually preaching, Jason.
I mean, I think you've pretty much said it all. The fact that, he's taking this drug as some sort of prophylactic against, the virus, and there's no evidence of it. We haven't seen it in any kind of clinical trials. I was just reading a new study out of China that says that none of that works. We saw Stephen Miller got it. His wife got it. It's running through the White House. He's not wearing masks. He's being reckless. He's setting a terrible example. And that's not what leadership is. What leadership is first setting the example yourself in order to make this country safer, in this case, flatten the curve. And he's really, setting a terrible example for, everyday Americans. And now we have children, dying. We had a child in Baltimore who just passed away from, COVID-related illness. So this is a really terrible situation when you have someone who is not responsible and derelict in their duty.
Lauren, here's what I think is happening. And Dr. Hilton, I would love for you to weigh in on this as well. 94,000 people are dead. Okay. They've said, it's going to happen by June 1st. At the rate we're going, look, we may see. I said this last week. It might happen by Friday. They refuse to acknowledge what's going on. Now we're hearing about a woman fired in Florida. They're trying to fudge numbers. We saw what happened in Georgia. I mean, you have, and we already know what the administration has tried to do by questioning the CDC numbers. They want to be able to suppress these numbers because it's bad news for them, Lauren.
Exactly. He's trying to turn the page, and he can't turn the page. I mean, this is a president, as we know, who thinks everything is about PR. He doesn't want to have this branded to him, which it's completely branded to him. It's completely branded to him because he didn't read his intelligence reports in December and January and February. There's no getting around it. We're going to hit 100,000 in probably less than a week. He is trying to turn this into another conversation and what the economy looks like after this is over, but it's not over because the stats are still coming in. He can't deny that. And, you know, there's nothing like 100,000 people dying to stop all the PR and all the nonsense. And he can't spin his way out of it. He won't spin his way out of it. There's nothing else really to say. The fact that he won't wear a mask is really related to his own vanity and his own PR, you know, obsession. He doesn't want to be photographed in a mask. He doesn't want to be seen in a mask. He knows that a photo of him in a mask is the actual epitome of this thing reaching right into the White House, which it already has done. And that's why he's not wearing one. So, you know, he's childlike. We know he's childlike. I think Joe Biden is going to get elected as a result of this and everything else that's about to happen with regard to the economy, which is all going to happen on his watch. And he can't blame anybody else, can't blame Barack Obama or anybody else. And basically he's trapped and he knows it.
All right, folks, back to our Roland Martin Unfiltered video in just one moment. This is the Seek VR headset created by Mary Spiel, the sister. We had her on the show. Black woman. She actually is the inventor of this particular headset. And so what happens is you just simply place your phone right into here, and then of course close it up, and then go to their website and then their app, and you can actually experience the comedy showcase. And so they have these headsets, these VR headsets on their site, seek.com, for sale. Then also they have these 4D 360-degree headphones. First of all, I love the two stuff because they're in black and old gold, my frat colors. But these are awesome because for gamers, it comes with a detachable headset. And again, folks, it gives you 360-degree sound. Amazing sound. If you want to buy these, you have a promo code you can use. This is just for our followers, and it is RMVIP2020. RMVIP2020. Put that promo code in if you want to buy the headphones, buy the VR headset. You get that discount to buy it. They're amazing. So seek.com, RMVIP2020. Now back to your Roland Martin Unfiltered video. You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. All right, folks, today on Capitol Hill, there was testimony. Rick Bright testified regarding the folks not being prepared for this coronavirus and national testing. We're going to play some of that in just a second. Right now, though, I want to be joined by Dr. Georges Benjamin, Executive Director of the American Public Health Association. Dr. Benjamin, real quick here, bottom line is this here.
I'm good. I got time for you.
These people are nuts, okay? General Russell Honore said, you cannot have a 50-state strategy. You've got to have a national testing strategy. Trump White House don't give it. They do not want any part of this. Governors, it's all on you.
Yeah, it doesn't make any sense. You got to have a national strategy. You got to actually have a plan, and you got to stop winging it. And these folks are just winging it each and every day, and that's a problem. And it's gonna cost lives.
The thing is, what I don't understand is how I just would operate real quick. That is, a national strategy means, all right, I need to be able to look at the map and go, more tests goes over here, more over here. We don't need as much over here. Let's shift them over here. If you don't do that, you don't know what the hell is going on. You might have a whole bunch of tests sitting in a state. They don't even need them.
Absolutely. And in fact, we already know that has happened. We've had states that said we can't find any tests, and we have other states that say we got lots of them. So it's already happened.
When you looked at the testimony today, what did you make of it? He did not hold back at all as he laid out the problems. I mean, they trust me, the Republicans were not happy that Rick Bright, this whistleblower, went before the House committee.
Well, he's a credible guy. He's worked hard. He's smart. And, I think he's just laying out the problems that we've had. We have a dysfunctional system and a dysfunctional leadership process. And he just laid it out for him. And I hope people just don't blow it off and think that he's just a disgruntled employee. Even if you're mad, there's credibility in what you have to say. And we're seeing the results of that each and every day. So despite what people think about his testimony, he says what he thinks. And I bet when they pull back the onion skin, we're going to find about all that is true.
One of the things that also I think is critically important, still, people who are impacted. Michael Harriet with the Root had this amazing story today about how these black women in this place in town in West Virginia were getting no assistance, and they pretty much figured it out on their own. They are not even medical experts, but where they showed how all these black people in this one town how they were impacted, got coronavirus at a church, basically learned how to do tracing on their own, and they saved folks in their community. And that's what we're dealing. I mean, people should not have to be resorting to that.
No. I mean, the understanding is out there. Look, we've been doing contact tracing since the early 19th century. So we understand this. There's no reason for people to have to reinvent the wheel and learn it on their own. And we need to get more of them. And look, if you want to get people back to work, we know that we need at least 100,000 contact tracers. So those are good jobs. So I don't know what they're doing.
It is confusing to all of us what they're doing. And so, we're going to stay on top of this, keep pushing, keep prodding. Please share, what should black organizations, what should black churches, what should we be doing since we're being left out here on our own by this clueless administration?
Well, I think the first thing you ought to do is band together and talk about what you can do to make sure you're all safe. I think you ought to be following the guidance that we already have, which is covering up your nose and mouth when you cough and sneeze, washing your hands, wearing a mask when you're out, but safely, because we know about this issue of masking while black. And as we begin to move back into work, do it very, very carefully, very, very, very carefully. And that means that when you go back to work or school, we need to practice physical distancing from one another. We need to make sure that we protect one another and be respectful of one another, whether we're in the grocery store or we're on the bus, because too many of us are public facing in our jobs. And we've already seen, like everything else, this disease kills more people of color at a faster rate than it does with everybody else.
Indeed, Dr. Benjamin, we appreciate it. We're going to keep pushing this. And at the end of the day, we got to keep focusing on us, because if we don't focus on us, clearly nobody else will.
No, absolutely. And I know the NAACP is looking at this very carefully. And I would just encourage people, you can go to our website, the American Public Health Association, at apha.org. We have some information, but the Center for Disease Control and Prevention is still the nation's prevention agency. We can trust them, and they have some very important guidance on their website that tells us what to do. I would encourage people to go there and use it.
Dr. Georges Benjamin, we appreciate it. Thanks a lot.
Roland, good to see you again.
All right, folks, here's some of the testimony today from Rick Bright.
That's a very difficult question to answer. I know that there are companies and academic labs working very hard. Normally it takes up to 10 years to make a vaccine. We've done it faster in emergency situations, but from when we had starting material in the freezer for Ebola. But for a novel virus, it's actually haven't been done yet that quickly. So a lot of optimism is swirling around a 12 to 18 month time frame. If everything goes perfectly, we've never seen everything go perfectly. My concern is if we rush too quickly and consider cutting out critical steps, we may not have a full assessment of the safety of that vaccine. So it's still going to take some time. I still think 12 to 18 months is an aggressive schedule, and I think it's going to take longer than that to do so.
12 to 18 months from now, or 12 to 18 months from when this all started at the beginning of the year?
It would be 12 to 18 months from when the particular manufacturers first received the material or information that they needed to start developing that vaccine. It's critical to note when we say 12 to 18 months, that doesn't mean for an FDA-approved vaccine. That means to have sufficient data and information on the safety and immunogenicity, if not efficacy, to be able to use on an emergency basis. And that is the consideration that we have in mind when we talk about an accelerated timeline.
Thank you.
Lord, Erica, the Republicans are not happy. Republicans are not happy. He testified.
I'm so glad that he did, because this is another person that we see that was assigned to that was inside of a federal agency, that because he did not do the things and say what Trump felt like he needed to say, that he was in effect pushed out. And just so that the viewing audience knows, as he talks about, the first number that he talked about was 10 years, the 12 to 18 month period. That's not even FDA approved for the vaccine. That just as recently as today, Dr. Joseph Fair, who works for NBC as a contributor, was hospitalized with COVID. And he says that he believes the way that he contracted COVID, he was on a plane. He said that there was not real social distancing, that he traveled to New Orleans very recently, and that the plane was packed, that the guidance about the middle aisle being taken out, that was not followed, and that he believes that he contracted COVID through his eyes. His eyes weren't protected. Again, people need to understand that this is a novel virus, and that as Dr. Bright shared in his testimony, and other folks that you've had on this platform and in writings have talked about, it is going to take real significant time. We're talking about experts who have battled Ebola in foreign countries, who do have expertise in this area. And so though Republicans don't like it, it is good for the audience. It is good for the body politic to understand this, because the negligence of this particular regime has now led to 85,000 deaths, which makes the USA leading in deaths from the coronavirus today.
Reese.
Yeah, I mean, listening to Dr. Bright's testimony was alarming. I mean, he really basically kind of said that we're screwed, and that Donald Trump and his administration has completely abdicated their responsibility to have a competent response. And what they're banking on, and I'm editorializing here, this isn't what Dr. Bright said, but what they're banking on is that people are going to be more concerned about getting to the bars. We saw the bar in Houston that was packed. I've seen it at least on social media and other places, than they are about the very, very very quickly rising death toll. I think people still haven't it hasn't set into them that this virus is not any less dangerous than it was when this whole stay-at-home push started. It's not any less dangerous. It's not any less infectious. It's not any less deadly. We've made no advancements whatsoever in the treatment. We're not any closer to the vaccine. And I even saw a survey saying 25% or more people won't even take a vaccine once it's available. This is something that's going to fundamentally shift our way of life. And people are still going about it like business as normal. And that's where the Republicans are unfortunately winning the messaging war on it, because people would rather believe a fairy tale than believe that they're going to have to radically adjust the way that they go about their daily life.
Greg.
Roland, this is a critical point you're raising now. The country, of course, is aware of Dr. Bright's testimony today. The Republicans ran out of questioners. Every Republican questioner sounded like the complete idiot they are, defending themselves by attacking everybody from Barack Obama to imaginary creatures or whatever else they could come up with. So it's a critical point for that point, of course. And as we've heard, we heard Erica walk through it, and then Reese, this is the importance of dealing with the fact that the federal political apparatus simply doesn't exist. In this venue, as we tie that to the story that you evoked, our brother Mike Harriet over at The Root, when he started talking about Ramelia Hodges and the other three sisters who kind of came together in West Virginia to stand in the face of this, you've now grasped something that our people need to pay strict attention to, this question of contact tracing. And so when these sisters in West Virginia, Hodges, Danielle Walker, who's a delegate in the House of Delegates of West Virginia, Tiffany Samuels and Terry Berkeley got together, they forced the hand of Joe Manchin, the senator in West Virginia, of course, who then offers resources to get people tested. But then West Virginia stopped gathering data by race, because now it's going to be an embarrassment. They had already shut down one of the only hospitals in the area that would serve Black people in that area of the state. But I'm raising this for this very specific reason. We're here in the D.C. area. I'm on something called the Black Coalition Against COVID. A bunch of D.C. folks are getting together trying to help our people understand that contact tracing is coming. You got to let people know who you've been in contact with. Those people they're not going to share the information with other people. Our people have right reason to be paranoid about the government and ask you questions about where you've been. But at this juncture, the federal government is broken. The state governments are battling back. We saw what happened in Wisconsin today, for example, where the Supreme Court overruled the governor in another show of naked partisanship, including that judge who lost his election last month. And they say, open up the state. That's going to put you at risk, Black people. So I was on a call yesterday with educators from around the country, Miami, Milwaukee, other places, Baltimore, and they were saying that our people are facing sickness and death, as we know, in an unprecedented manner. But this contact tracing issue is real. And so when you see what happened in West Virginia, even as Dr. Bright is saying this thing is going to get worse, and Donald Trump continues to turn his head to try to have campaign rallies like at this factory today when he's over there playing around with testing equipment, our people need to understand that it doesn't take money to ask questions. So the churches, the Masonic organizations, as you always say, the fraternities and sororities, it's time for us now to get real about identifying who is sick, getting them resources, helping sequester them if we can, because until we put pressure on people to get more resources, we are going to be the ones that die. And contact tracing, this issue you're raising today, contact tracing is something we should be talking about every day.
All right, folks, back to that Roland Martin Unfiltered video in just one moment. All right, fam, to all Roland Martin VIPs, you are invited to the Laugh Experience, taking place this Friday, May 15th at 6 p.m. Pacific, 9 p.m. Eastern at seek.com. That's CEEK.com. Join me and let's laugh with comedian D.L. Hughley, Chris Spencer, Bodacious, Ryan Davis, and Clint Coley. It's a first-of-its-kind virtual comedy show on Seek.com. Seek.com, remember, y'all, is the black website created by this sister. Y'all. You can watch it on your phone, your laptop, even in virtual reality. Now, I'll be there, and I hope you will be there as well. Now, remember, we had Mary on the show, of course, the creator of Seek. She also is the one who created her own VR headset. So they have these available at Seek.com. And so it's real simple. I was actually testing this out a couple of nights ago. Actually, it's pretty cool. And so just go ahead and zoom out, Anthony. And so it's real simple. You take your phone with this head. Now, there's some VR headsets where you can actually connect to the web and stuff along those lines. But this one here, what it allows for you to do is, so you actually have you go to the Seek app, and so you can pull it up here, right here on your phone. And then what you do is you place your phone right into the VR headset, close it up, and then you're able to then put this on. And so what's going to happen is you put this VR headset on. Y'all, what's so cool about this is that it literally looks like you're in the room. So what's going to happen is they'll be live, and so you can sit here and you can look all around. You can look at the ceiling all around. It's going to be pretty cool. The first time ever, again, a virtual reality comedy showcase that's taking place this Friday. And so that's what it looks like once you're inside. You get to be able to look around on the inside of this room. It's pretty cool. And so you can do this again. It's created by a sister, this device and the site as well. She also created these 360-degree sound headphones. Y'all, these are boss. Okay, Bluetooth, as well as you could actually plug in. The Bluetooth creates the whole 360-degree sound, and so it's great for gaming as well. And so if you do use these, there's a promo code. Go ahead and write this down. The promo code. This is the headset right here. These are the headphones right here. You don't have to watch the virtual comedy showcase with your headphones. You can watch it right here on your phone. It's not a problem, but it does give you a whole different experience when you're watching it in virtual reality. And so what I want you guys to do is if you want to get these headphones, get this headset here, I want you, there's a promo code that you can enter in to be able to do so. And so let me pull that promo code up. And it's been, like I say, I've been having way too much fun with this whole deal here with these headsets. And this is called the world's first 4D 360-degree audio headphones, and of course this is the mobile VR headset, and so that's what you have here. They have a special code for our followers here at Roland Martin Unfiltered, and so we're gonna pull that up. And where is it? I thought we had it here, and so we had all these different emails back and forth, and so I'm trying to find it. Promo code. All right, this is what you use. To buy the headset, to buy the headphones, go to seek.com, CEEK.com, and use RMVIP 2020. Now back to your Roland Martin Unfiltered channel.